with the WHO and the community health authorities, the European Commission. We are activating the protocols that have been carried out with people from Spain, Spanish people. What we'll do is this: we will receive these people, evaluate them in Puerto de Granadilla with the other passengers. Then they will be transferred to the Gomezulia Hospital. That's a Ministry of Defense hospital. We will follow all necessary protocols. What we'll do is this: we will be especially cautious, we will take special care in terms of safety, security, we will protect the people who arrive, we will also take all necessary measures for public health, because in case there was someone with symptoms, so nobody could be infected, be it a member of the population or anyone else. We will use the appropriate measures and we will observe quarantine for these people in Gomezulia. As you know, that is a Defense Department hospital. It has security units. These are Guatan units for isolation and treatment of high-risk cases. They would be able to isolate these people. There are another 16 beds. There's going to be a meeting with the other autonomous communities of Spain in case we need to activate those beds. In Gomezulia, we can have the capacity to provide isolation. We will have all the tests needed, serological tests and so on. So we'll follow protocol, and we will do what is required in terms of tests. Regarding communication with the government of the Canary Islands, I think this government has handled a lot of emergencies. We are clear what must be done. We must handle the crisis, the emergency, help the victims. We must always work on the basis of scientific evidence and work with other authorities. We must communicate to citizens through the media. We've been doing this. We've been in contact with Canarian government at all times. This morning we had technical discussions with the Alert Committee, of course, the health authorities and the head of the health service. We have been in close contact. As the Interior Minister said, in these meetings, the civil protection mechanism is incorporating, of course, the Canarian government. So, in principle, repatriated persons, in line with this civil protection mechanism, if they have no medical impediment, will be repatriated to their countries, where they will follow protocols and observe guidelines in place in each country. Hello, good afternoon. First of all, I would like to ask this. The President of the Canary Islands is asking for direct repatriation from Cape Verde, saying the boat should not go to the Canary Islands. Why is this not possible? Is it because that country does not wish this, or is it because the correct conditions are not in place? Could you clarify this for us, please? Secondly, I'd like to know this. Could you explain a bit more about what you know, what the government knows about this virus? How contagious is it? How is it transmitted? All the details you can give us on this. Also, the level of concern in the government. What message would you like to send to society in this regard? I must insist. So let's talk about the health element. I'll repeat what I've said in the beginning, how it is spread. It is spread mainly through rodents, through excrement and urine. It's exceptional to have this type of contagion. The references that we have list very few cases around the world of this kind of crisis. Very few people have ever been affected, especially transmission among humans is rare but cannot be entirely disregarded. It can happen in very close contact with symptomatic people. That's what we know. It's highly lethal, heading for 50%, but transmissibility is generally via feces or urine of rodents, and transmissibility between people is rare but cannot be ruled out. This is one of the things we must make sure of. Regarding, we've mentioned this, the WHO has chosen the Canaries and Spain to be the best place to bring the boat, the minister has mentioned. As the minister said, it's the WHO, the World Health Organization, that makes the request. There examines the capacity of countries to accept the boat. It's not just the country with technical capacity to handle the situation, but also because we're within the EU. The good thing about the EU, this multilateral environment, is this. We have a mechanism like the civil protection mechanism within the EU. This enables us to ensure repatriation of crew and passengers in the safest conditions possible. This is related also to us as a country and us as a member of the EU. With that EU mechanism, that is what determines the logic of this course of action. Well, we have been listening out since yesterday, since the weekend, through the contact with the WHO and the ECDC. Whenever these situations arise, we have to coordinate. So there are various levels at the level of Spain, across Europe, and also globally. In this regard, we've been in constant contact and coordination. We've been looking at the situation minute by minute. So there were many meetings yesterday with many organizations, government agencies, and also health organizations to global level. And we've been following the situation minute by minute, as is necessary. Thank you. I would like to insist, given the first response, there's no clear answer on how long people have to spend in quarantine if they've been in close contact with an infected person. And regarding the controversy, President Clavijo has said this several times. He's criticized the lack of information and indeed contradictions from the government. He said yesterday, early, he was told they would not accept that this boat should go to the Canary Islands, but there's been a change. So why is that? So has the national president has spoken to the president of the Canary Islands, President Clavijo. That was one of the requests. Well, the incubation period is around 45 days, the incubation period. The time during which we believe people should be in quarantine depends on the technical meetings, starting from what we see as day zero of contact. Regarding meetings that we've had with the Canary Islands and declarations by Mr. Clavijo, we will not enter this political controversy. I don't think that's appropriate right now. We are managing this crisis. Firstly, we must manage the crisis in collaboration with the government of the Canary Islands, as the Interior Minister has said. Yesterday, we had many meetings. We got up to date on the different situations. Yesterday afternoon, the WHO said that for security or safety reasons, public health reasons, it would be necessary to take this boat in terms of public health. Canary Islands was the best place. That was the closest port with the correct security conditions or safety conditions. This is what was evolving yesterday. The government of Canary Islands was informed of this at every moment. Hello, ministers. Guillermo has asked a question I'm interested to know too. Has there been a call between the national president and the president of the Canary Islands? Also, who will be in charge of the protocol in the port? In the Canary Islands, which medical staff will the Gomezuya transfer then be military? But first, care provided. Who will provide that? Also, that meeting. I think that's all. Thank you. I will respond to who will be treating the people in the port. We'll use the mechanism for exterior health. This is quite common. So, for the foreign health, we will see this body working with support from the ECDC and also with the EC health body support. So we'll carry out an evaluation of how those passengers are. I must repeat, at all times, I've been talking to the president of the Autonomous Community of the Canary Islands. Today, I've been speaking to him. He will be included in all meetings that relate to the civil protection mechanism. I must repeat, until this boat arrives in Spain, well, that will take 3 or 4 days for the boat to arrive. In the meantime, we'll have all the meetings, all the contacts necessary. These meetings will be ongoing within the European Civil Protection Mechanism, so we can have minute-by-minute analysis of the situation as it evolves, so we can see what needs to be done in logistical and health terms. This is important. We have the means available. We are able to handle this type of situation using our infrastructure and working through the EU. Thank you. Hello. A question. Once after the meetings yesterday with the WHO and Canaries, well, was all information transmitted to the Canarian government? This morning, interventions by Mr. Clavijo have created alarm. The health minister, I'd like to ask you, do you know if the Canary Islands has these isolation units, if Ken is provided there? Can you confirm the virus involved? Is it the hantavirus? So what's the strain? The hospital in Tenerife has a WATAM unit. We heard this was not yet available. It should be available in 24 to 48 hours. Across our territory, there are another 16. 8 are in El Gomezuya. So Gomezuya will be the place that Spanish citizens will be taken. Clearly, all communications throughout the meetings with WHO, ECDC, and so on, all these decisions that are being taken, they have been passed on to the Canarian government. And of course, this is only correct. I'd like to stress this. At all times, there has been communication and provision of information to all authorities concerned. This includes the Canarian government. As a result, once the European mechanism for civil protection has been activated for clear reasons. The Canarian government is in the loop. When it was found that the boat should go to a Spanish port in the Canary Islands, in consultation with the WHO, we considered our own legal obligations, thanks to the conventions we have signed, and also ethical considerations. There is an ethical criteria that underlies international law, of course.
It looks like we've lost the feed. It's really interesting listening to the Spanish health minister there explaining what's exactly happening. Clearly quite a row brewing between the Spanish government on the Spanish mainland and the Canarian authorities, of course, the Canary Islands, an autonomous community of Spain. The Spanish government is saying that those on board this ship should be taken off board at Tenerife and then repatriated to their own countries. The Canary Islands are arguing, why can't this repatriation happen at Cape Verde, where the ship has been, and what is going to happen to those passengers once they come off the flight? Well, the Spanish government is saying that if they don't appear to have any symptoms, which appears to be the case for everybody else on the ship as far as we know so far, that they are saying that there are no other apparent symptoms between other passengers at the moment on the ship. The Spanish government are saying that if people haven't got symptoms, they can be repatriated back to their home countries. But they're also saying that anybody who's Spanish on the ship, they have to go back to Spain and stay in a military unit. So they are going to quarantine their own population, but they're not going to, curiously enough, quarantine the rest of the world's population. So that was the latest that we are getting from the Spanish health minister. They say that they want this ship to dock in Tenerife and they want the passengers brought ashore there. We also heard more about the evacuations to the Netherlands of the two flights that have come off that ship. We believe that one of those that has been evacuated today, there are some reports that it is a British man, potentially the doctor on the ship, but Sky News has to confirm that ourselves yet. But there are some reports that one of those who's been evacuated today is a British man who was the doctor on the ship who's been evacuated to the Netherlands. As soon as we're able to establish whether that is the case, we'll bring it to you and we'll bring you more.